Provident aims to connect St. Louisans to the mental health services that they may need. Joining us is Director of Life Crisis Center, Jane Smith. Welcome, Jane.
Thank you. Thanks for having me.
Yeah, so Provident has been around, I just learned this from you off camera, since 1860 here in St. Louis. I mean, that's amazing to think about an organization that's been helping our community for that long.
We've been around for a long time. Yeah, we originated during the Civil War, helping people that were underserved at that time, the sick, the homeless, the people that didn't have enough to eat. And we have evolved, obviously, over the years to meet the needs of the community.
So you started out helping the homeless, the hungry, and you've evolved to now focus primarily on mental health needs. Is that correct?
Absolutely. We help families to a brighter future through our counseling services, crisis intervention, suicide prevention, and we also have a lot of community support services.
Okay, so 5 locations around St. Louis.
Right.
Okay, and you're available for anybody in St. Louis?
We are available to anybody. We help children, we help the elderly, we help adults, we help people over the phone through our crisis intervention services. We have an office in Illinois. We've got 4 in the St. Louis area, North County, West County, South County, and then in the Midtown area as well.
So how are people finding you? Is it primarily referral from their physicians? Do they walk in the door? What's the process?
Many ways, many ways. We obviously have a website, providentstl.org. People can find us there and get some more information about our services. We do get referrals from physicians. We get referrals from schools, friends, families who have had really good quality counseling services from us.
Yeah, okay, so your role specifically is helping those in suicide prevention area.
Right, exactly.
Okay, so let's talk about that. Is that a need that you see rising in our community?
Sadly, it is. We are home to the Life Crisis Services Hotline. It's a local hotline that people can access anytime at 314-647-4357. One of the oldest hotlines in the country. It's 51 years old. We also are home to one of the sites of the National Suicide Prevention Lifeline. So when people see 1-800-SUICIDE on TV, it will say, call Lifeline. That call may actually reach one of our centers.
So the crisis hotline, 24 hours a day?
24 hours a day, 7 days a week, people can call. We are staffed.
Yeah. So you do see the need rising. Are the phone calls increasing? And if so, why is it happening?
That is a great question, and we do not have all the answers. Suicide rates are rising, unfortunately. They went up 3% in the last year, 5% for women, 8% for young people, ages 15 to 24. It's staggering.
In the last year?
In the last year alone.
Wow.
And we are here to meet that need. We have recently increased our call volume from about 30,000 calls in the previous year. We're anticipating about 50,000 calls this year.
Wow, that is not a goal you want to see met.
It is not, and we are so...
I mean, that's amazing to me, and it's scary.
Very scary.
And so as a staff, you know, are you thinking like, what can we do to prevent those calls, to prevent the need for the calls? I mean, obviously you want people to call if they need someone to talk to. So what happens when they do call?
When they do call, they will talk to a trained volunteer or crisis worker who knows specifically how to assess suicide risk. Very well trained people. They will ask them if they're having thoughts of suicide. They will ask questions about whether they've made some plans, have a time frame for suicide. They'll ask if they've attempted suicide before, ask what's going on in their lives. You know, usually a bunch of things will precipitate somebody feeling suicidal. So they will get a very thorough risk assessment along with a really helpful, healthy listening ear, and then direction to resources that will actually help them to take the next steps to getting the help they need.
All right, we're going to take a quick break and come back and talk more about what are the warning signs and who's calling, who are the people reaching out to help. Is it the potential person at risk, or is it a family member? So we're going to take a quick break, Jane, and come back. So please stay with us at STL Live. We'll have more with Provident and Jane Smith after this break.